Okay, hi, good day. This is Daniel Tagahan, and for today's video, I am going to tackle about nosebleed. So, what is nosebleed? What causes nosebleed? The two different kinds of nosebleeds, and what to do if someone experiences or if someone has a nosebleed. So, let's find out. Here we go. Okay, so what is nosebleed? So a nosebleed occurs when one of the blood vessels in the nose's lining bursts. Infection, injury, allergic reaction, nose picking, or an object being pushed into the nostril can all cause nosebleeds. Epistaxis is another term for nosebleed. Nasal bleeding is common in children and is usually not serious. Although seeing blood coming from your nose can be frightening, most nosebleeds are minor and can be treated at home. Some, on the other hand, should be checked by your doctor. For example, if you frequently experience nosebleeds, consult your doctor. This could be an early sign of other medical issues that need to look into. Several nosebleeds begin in the back of the nose. These nosebleeds usually involve large blood vessels, cause heavy bleeding, and are potentially dangerous. This type of bleed requires medical attention, especially if it occurs after an injury and has to stop after 20 minutes of applying direct pressure to your nose. So are there different kinds of nosebleeds? Yes. Nosebleeds are described by the site of the bleed. There are two main types and one is more serious than the other. So the two different kinds of nosebleeds are the anterior nosebleed and the posterior nosebleed. So let's tackle first the anterior nosebleed. So anterior nosebleed starts in the front of the nose on the lower part of the wall that separates the two sides of the nose, called the septum. Capillaries and small blood vessels in this front area of the nose are fragile and can easily break and bleed. This is the most common type of nosebleed and is usually not serious. These nosebleeds are more common in children and are usually able to be treated at home. The second is the posterior nosebleed. So it occurs deep inside the nose. This nosebleed is caused by a bleed in larger blood vessels in the back part of the nose near the throat. This can be a more serious nosebleed than an anterior nosebleed. It can result in heavy bleeding, which may flow down the back of the throat. You may need medical attention right away for this type of nosebleed. This type of nosebleed is more common in adults. So what exactly causes nosebleeds? So there are numerous causes of nosebleeds. Fortunately, the majority are not serious. Dry air is the most common cause of nosebleeds. Hot, low humidity climates or heated indoor air can both contribute to dry air. Both environments cause the nasal membrane, the delicate tissue inside your nose, to dry out, become crusty or cracked, and bleed more easily when rubbed, picked, or blown. Other common causes of nosebleeds include nose picking, colds and sinusitis, especially episodes that cause repeated sneezing, coughing, and nose blowing. And then blowing your nose with force, inserting an object into your nose, injury to the nose or face, allergic and non-allergic rhinitis, blood-thinning drugs like aspirin, non-steroidal anti-inflammatory drugs, warfarin, and others, and then cocaine and other drugs inhaled through the nose, then chemical irritants like chemicals in cleaning supplies, chemical fumes at the workplace, and other strong odors, and then high altitudes. The air is thinner and drier as the altitude increases, and then deviated septum, an abnormal shape of the wall that separates the two sides of the nose. So frequent use of nasal sprays and medication to treat itchy, runny, or stuffy nose. These medications, antihistamines, and decongestants can dry out the nasal membranes. Other, less common causes of nosebleeds include alcohol use, bleeding disorders such as hemophilia or von Willebrand disease or leukemia, high blood pressure, facial and nasal surgery, nasal tumors, nasal polyps, leukemia, and then lastly is the pregnancy. So how do I stop a nosebleed? So follow the steps to stop a nosebleed. First is to relax. The second is sit upright and lean your body and your head slightly forward. This will keep the blood from running down your tooth, which can cause nausea, vomiting, and diarrhea. Do not lay flat or put your head between your legs. Third is breathe through your mouth. Fourth, use a tissue or damp washcloth to catch the blood. And then, fifth is use your thumb and index finger to pinch together the soft part of your nose. Make sure to pinch the soft part of the nose against the hard bony ridge that forms the bridge of the nose. Squeezing at or above the body part of the nose will not put pressure where it can help stop the bleeding. And then, keep pinching your nose continuously for at least 5 minutes before checking if the bleeding has stopped. If your nose is still bleeding, continue squeezing the nose for another 10 minutes. After the bleeding stops, do not bend over, strain, or lift anything heavy. Do not blow or rub your nose for several days.